Good morning, everyone. Hope this is working. This is Dr. Seth Gerlach, and I've got a very special guest today with me, Dr. Zinia Thomas, who I will introduce here in a second. But, I'm doing some more of these to bring some more awareness of the amazing capabilities of the body and people especially in our area, St. Louis area, that are doing wonderful things in the natural health space, the natural health field. Because a lot of the stuff people don't know about, but they need to know about it because it can be so beneficial for people's health. But today, we want to talk specifically about IV nutrition therapy. So intravenous nutrient therapy, all the crazy benefits of it, who can it be helped, and really, we're going to dive into more about Radiance, Float and Wellness, which Dr. Zinia Thomas has also. But first, let me introduce Dr. Zinia Thomas. So Dr. Zinia is board certified in both adult psychiatry and child and adolescent psychiatry by the American Board of Psychiatry and Neurology. And so she started out in this field. Now she has opened up Radiance Float and Wellness, which has a ton of therapies I'm sure we can talk about today. But help me welcome Dr. Zinia Thomas. Really stepped outside the box in a really cool way. So how did that come about? And then what made you shift?
Yeah, it's not easy. You're trained in a certain way, and it's you just know there's just countless data and information that's pounded on you, and always search for evidence base, and and then they come out with great evidence from big pharmaceutical companies, but the data doesn't always extrapolate to the everyday person. There's always comorbidities that are going on that they don't actually fit into that niche, and so then the treatments that are shown to be very effective don't always work for people. And I was conventionally practicing for many years. I finished my training in '05, and then it was kind of by my patients that they kind of demanded more, wanted more, and were just not happy. Yes, they would get better, but after chronic consumption of some pharmaceuticals, they were just like, there's no other way, or yes, I'm taking these things, but probably for the last 6 months or a year, I don't feel any better, or anything is anything working? And so I think a lot of colleagues, or how I was trained, would be like, yes, it's working, continue on it, you'll be fine. Add some therapy in, or add a little bit of something else to just boost it up. But then people kind of kept saying, no, it's not working. And one thing I really liked was I feel like I can get the diagnosis from my patient. So I always was someone that spent a lot of time and talking about underlying issues, and that this kind of just naturally evolved into being able to treat people with nutrition.
Yeah.
Which was fascinating, and then something that most doctors don't know anything about.
Yeah. So how much nutrition did you get taught in medical school? I'm just kind of curious.
Yeah, it's very fascinating, but 0 hours of nutrition.
Oh my goodness.
0. Maybe you can, think that like in biochemistry, they touch on, amino acids, and maybe if someone was very savvy, they could understand that, I do have
Right.
tryptophan in my Thanksgiving dinner, but there's no connection like that these chemicals are actually from food. And so that's kind of a discouraging thing. My undergrad degree was in human physiology, so I had a lot of exposure to physiology and nutrition in my allied health undergrad degree. But right, if most people don't have that undergrad degree, and so there's very little.
Yeah, that's unfortunate, because I think the majority, and we talked about this before, the majority of health concerns today can be addressed, or they're due in large part to the foods that we consume every single day. So that's a whole topic for a whole nother day, but it just kind of goes back to conventionally trained versus naturally trained, and things like that. But so you were treating patients, weren't seeing results, and then I guess you just started looking elsewhere. So
Elsewhere, they were demanding it. I was getting some extra kind of specialized testing, and then there were panels on how people would metabolize medications, like how their livers are functioning. But another thing was just sort of, are there any genetic SNPs or like
oh yeah.
cuts out of their genetic makeup? And the SNPs that the panel that I was using were coming back, strong, positive for certain ones that, namely MTHFR and other issues in that whole methylation pathway, which then is directly correlated to someone's sort of detoxability in their own body. And then it's almost directly correlated to mental health issues, that because some of these byproducts that are made from this methylation pathway are needed to make neurotransmitters like serotonin and dopamine and norepinephrine. And so when you're not functioning in that pathway, is not functioning properly, you're going to have issues in mental health and in cardiovascular, in GI, the list goes on. And so then I would capture those people. And when I started treating one person with sort of B vitamins, B12, methylfolate, they just got dramatically better. And it was almost like it was working with the medicines they were on initially. And then we found that, that was just some progress, that some people need the medications for a boost in the beginning, but to be able to kind of try to train your body to heal it on its own.
That's awesome. So you started individualizing people's care, really. That's how you really got into it.
Yes, exactly.
Looking at genetics and nutrients for the specific person.
Exactly.
That's awesome. Good for you. That's really, yeah. I feel that's where the future of medicine is. It's individualizing people's care, whether it be some of the therapies we're going to talk about today or nutrients, detox, things like that. That's awesome.
Right. Absolutely.
Dr. Zinia, I did have a question already from Stacy Neal. Hi, Stacy. Thanks for commenting. But she asked, how did you come across floating, or how did you get into floating in the beginning?
Yes. So that too, combined with sort of treating patients, medically, how to add in something that could give you that benefit. And I floated for the first time in, I think it was like spring of 2016. And almost I knew right away after my first float that this is something that, that I need to incorporate into my life, family needs to incorporate, and my patients. And just the relaxation I felt, I was like, oh, this has to be a treatment for anxiety and mood issues. Right. Even just that, sensory overload, just that stress that people feel every day. If you're, working, or if you're a business owner or, physician, anything, just stress. Yeah. Just getting that solitude and decrease from sensory bombardment is so beneficial.
Wow, especially in today's world, right, Dr. Zinia? It's we have so much stuff going on. There's, people got jobs, they've got kids to run to places. We've got emails nonstop. We've got phone calls. We've got iPhones in front of our faces.
Yes, you're always too connected.
Hey, I would agree with you. Mm-hmm. We need to disconnect. We need to go backwards a little bit, I feel like.
Yeah, exactly.
So I love some of these therapies, and I do want to dive into, like we talked about, IV therapy. So let's jump into that. And so that's just one of the therapies. Will you quickly tell other people just some of your other therapies at Radiance before we jump in IV therapy?
Yeah, sure. So we kind of first started, I kind of wanted the float to be the main shebang here. That, like I said, I first floated and was like, okay, more people need to know about this. And if I could bring in several different wellness therapies under one roof, how well could that benefit the community? And so we call our big four the float therapy. So 1,000 pounds of Epsom salt in a dark room, which kind of decreases your sensory input, just helps you kind of get into that meditative state, relax, and kind of recharge your brain. The other service I love is the infrared sauna. Infrared sauna uses light instead of heaters to kind of penetrate your body fairly deep, about 2 to 3 inches, and then that way it creates that movement or heat there and pushes out toxins that are stored there. And so it's a great cleansing, service, a great detoxification service. It's shown to decrease cortisol, which also is a big culprit in our stress levels and issues like adrenal fatigue, things like that. So, great natural way. It's also a great metabolic burn. It's like a workout without a workout. Another great workout without a workout is our cryotherapy. So using cold nitrogen gas to cool the body down to sub-zero temperatures, which really helps pain, inflammation, also a mental boost of well-being. It kind of gives you an endorphin surge, similar to exercise. So kind of people feel like that runner's high after they have a 3-minute cryotherapy session. And then the salt room. That's one of our favorite ones for kind of our breathable organs, our lungs and our skin. And kind of sitting there, inhaling the salt. It feels like you're a week at the beach.
That's so cool.
Great for St. Louis summers, right?
Yeah. So you got a little bit of everything all under one roof, and I love how you guys did that, because it's very rare to come across a place that has all these things under one roof that are so great for wellness, really.
Yes.
So while we're on the topic of benefits, so what would be some of the benefits you see with IV therapy? And I guess maybe explain to some people who don't understand maybe the concept of it, just kind of briefly, what it is and the big benefits.
Perfect. Kind of like what we kind of started talking about, the importance of nutrition. And also I like what you said, the kind of going back to the basics. And the father of medicine, Hippocrates, he was a physician that said, let food be thy medicine and medicine be thy food. And I think that sort of sums up IV nutrient therapy in particular, that we're going back to the basics. We know what our body needs to run on. There's essential vitamins. That means that your body needs to get them from our diet, or supplements. We cannot make them on our own. And so there's certain essential nutrients and that we need. And then plus we have other nutrients that just sort of heighten our abilities, heighten our immune system, just will take our health to another level. And those are always great to get from our diet as well. The problem is that a lot of our absorption system, or the GI tract in general, is in disarray. There's been a huge uptake in leaky gut symptoms, inflammatory bowel conditions, irritable bowel conditions, that really when some part of your GI system is inflamed, that you're not getting in the appropriate nutrients that you need.
That's very true. I tell people that all the time. Our digestion process, it can be fraught with things breaking down, and we're not able to absorb this. And we've got inflammation here. So I always teach people, things on how to increase their digestion. But IV therapy kind of goes above and beyond that and bypasses it and goes straight into the cells. Am I correct?
Right. Exactly.
So another thing too is I don't know if you talk to people about this, but kind of the health of our soil. So the nutrients we can get from plants is kind of diminished also.
Right.
Do you find that also?
Yes, absolutely. So even if we, could absorb, so some people's like, oh, I healed up my gut and I eat very clean and organic, and that's great. And hopefully, you want to keep doing that. But right, the magnesium in our soils today, the nutrients in our soils today are not there as they were before, over farming practices and, even just the cultivation process in general.
Right.
Leads the soil to not have as much folate or magnesium as it did before. So as much as it's important to get those nutrients from whole natural foods, which will just prevent your gut from getting inflamed, it is also important to, supplement our body. And then there's I found out so I remember I was talking about earlier that I started with sort of supplements or nutritional based practice. Some people did great. Some people's levels on blood tests wouldn't budge at all. And then kind of when you look into it more, absorption of tablets with all the fillers and even just the quality of tablets and supplements are not always, or are not FDA regulated at all. There's really no regulation on certain supplements. And so, going to Sam's and getting some vitamins is a lot different than getting sort of a pharmaceutical grade, in terms of what's in there, what they promise it's in there, and then also just how it's packaged. And absorptions of tablets are consistently found to be about 20%.
Yeah.
capsules may be a little bit better, but still about 40% of absorbing what you're getting. And if even 1,000 milligrams of vitamin C is not in your tablet or capsule, what are you getting? And so giving something intravenously, you sort of bypass that whole GI tract, and you access someone's vein, and you give the nutrients that way. And the nutrients are the smallest breakdown product of what you would take in any way. So there's no digestion required. The digestion process already happened. And basically these nutrients are ready to be used by your body to create proteins, cells, hormones, neurotransmitters, great molecules that your body can just heal that way. At the same time, what I like to say is that, it gives your body a rest for your digestive system, a rest for a little bit. Yeah. And when we can do that, we're already healing our gut.
Yeah, that's great. And I always tell people, we're not deficient in, Prozac. We're not deficient in, proton pump inhibitors or high blood pressure meds. We're deficient in nutrients.
Right.
Nutrients we need from our food. And because our cells run on nutrients, like the one you talked about, there's minerals, there's amino acids and vitamins, all these things that our body needs in really good quantities in order to function correctly. And when we don't have those, the body breaks down.
Right.
It all depends on where it breaks down first. Is it going to be the gut? Are we going to have brain symptoms? Are we going to have skin symptoms? But I love how we can bypass that with IV nutrition, go straight to the source and replenish really and revive the cellular health, which kind of drives everything else. So what are, I guess, some of the big nutrients that you use in your IVs? And I know you have a bunch of different kind of cocktails for all different kinds of people and situations and conditions. So what are your, the most common ones you use and your favorites, really?
Okay, great. So yeah, this is a great question. So IV nutrient therapy is not very new. I think a lot of people have not heard about it in this area, but it was a Baltimore physician, Dr. John Myers, in the 50s, 60s era that kind of sought to bypass the gut in the first place. So in his patient population, he kind of noticed when I give magnesium, calcium, B vitamins like a B complex, and zinc, that people got better, and he was curing all sorts of different ailments, from asthma to fibromyalgia to migraines, with these 4 nutrients. And so it's not necessarily specific. You're not saying, Prozac is for depression. Magnesium is for all these different things. Like you said before, we are nutrient deficient. And so when you give these nutrients back, that multiple organ systems can get better. And I love how that kind of goes back to that functional approach that, one thing, if your body is one whole system, and that you can't really affect one organ without thinking there's going to be consequences or effects in other places. So kind of getting, improving our magnesium status could affect so many different ailments. And so when he passed, he never really wrote any of these formulas down. And so we don't actually know the full formula of the original Myers, but most people just, patient reports said, oh, he mentioned magnesium and the and so we put them together.
Yep.
Now we know it's just so many more great ingredients that our body needs, and we found out different amino acids, which are the essential amino acids, and so we've sort of taken a little variant or modernized the Myers cocktail. We call it the Mega Myers, and I think that's a great place to start to see if IV nutrient therapy is right for you. It has a great mix of probably things that most people are deficient in, just because even if they eat a healthy diet, and it's a quick bag, probably takes about 30 to 40 minutes, and most people feel a great boost of energy right after.
That's awesome.
But again, that's probably one of our basic nutrients. Like I said, we have so many other great nutrients. And so we started with like a wellness menu that our tagline here is, relax, play, energize, and heal. And so we kind of had a bag to fit all of those things. So our energize bags usually have high amino acids, both the essential and non-essential, branched chain. So great for people after a workout, before a workout. B12, which also just boosts our energy levels. Our heal ones have high dose vitamin C, glutathione, which are anti-inflammatory, antioxidants, great for immune system boosting properties. And that was a really popular one. We call it the remedy in the kind of winter, fall season,
Right.
when weather change.
Yeah. So you see people coming in with like common cold, flus, things like that?
Yes, common cold and the remedy bag, they get it and the next day they're feeling better.
Yeah.
It's
So
like,
how much, do you know how much offhand vitamin C is in one of those bags about?
yeah, you have 25 grams of vitamin C in the remedy, and that's amazing because you can't, that's going to just nip any kind of viral or bacterial infection right away.
Right.
And you can't absorb that much orally, and that's another benefit of using the IV intravenous system, is that your gut can probably only absorb 2,000 milligrams of vitamin C before before it just excretes it, and then also have GI side effects like diarrhea.
Right.
So giving the dose is so important.
Yeah, the dose is dependent because I always get people come in and they say, I took vitamin C, and I say, okay, how much vitamin C do you take? And they say, well, I had, I saw a 250 milligram tablet I got from Walgreens. I'm like,
Right.
it's not gonna do the trick here. So
Right.
the dose is dependent. Vitamin C is very effective
Very-
in a high enough dosage.
Right.
It can be the immune system that can be directly toxic to other things, viruses, all these kind of. And then a lot of the studies, like some of the bigwigs put out, they say vitamin C is not effective. But again, they were using these very low dosages, which is very interesting. And we're actually one of the few mammals that does not produce their own vitamin C.
Right. It's essential. It's an essential vitamin. And people will report like, oh, orange juice or whatever, all these things are 100% vitamin C. But then again, that is not, you don't want to drink all that juice. You don't want to drink all those things because they're loaded with sugar. And so they're causing problems. So
for sure.
Yes, so that is an essential vitamin.
That's great. So you've kind of got a full spectrum of whatever people want. If they want to ease in, if they want energy.
Yeah.
I also see if like you're recovering from a night out, even and all.
Our play category has the after party, which is our popular hangover cure, and it kind of just repletes. Alcohol is such a toxin and a stressor on our body. Plus, when we're not sleeping and just kind of going, you just want to kind of replenish. Obviously, we don't want to promote that kind of behavior day in and day out, but by by kind of getting it back into balance and, giving the nutrients that it needs, it's a little bit, you'll lessen the burden of the harmful effects on it.
It's all about replenishing these nutrients so the detoxification system has the ability to do what it should be doing, right?
Exactly.
Right. Gotcha. Do you have any cool success stories? I know I've done IVs before. I've done a lot of IVs. I've done the Myers, love the Myers, things like that. I've seen it firsthand to do some very great things for energy and skin and fighting off infections and so many other things. I mean, I'm sure you see some of the stuff day in and day out. Do you have any that stick out on top of your head?
Yeah, so people like I said, come in for their basic bag, and then while they're infusing, we'd get talking, or they would just kind of bring up some symptoms to the nurse, and just because of the training, we had like special certification in IV nutrient therapy, and also a course from the American Academy of Anti-Aging Medicine, and so when you hear some like issues, GI issues, for example, there are great nutrients that can heal so many different, disease states or other conditions. And of course, they're not FDA approved to target this disease state, but by knowing basic biochemistry plus these kind of nutrition, you can, really improve a lot of things. So probably 2 months ago, maybe 2 or 3 months ago, we came out with a therapeutic menu, we call it. So not only, so like IV, you asked who is it good for? It's good for, anybody really. And so like our basic wellness menu is anyone off the street that may be on supplements or don't like to take supplements and just kind of need that extra boost in their nutrition or health status. And then we have a therapeutic menu, and those are really maybe just a little extra to target a disease condition, maybe to help lessen the burden of medication, or they're already on 3 medications and their blood pressure is still high, and so what can we do? What else can we do? And so we've had such great success stories with several of our therapeutic IVs. Namely, one is our GI health, which is really popular. Again, like we talked about, just giving IV nutrients can give the GI system a rest, and then also giving the nutrients IV ensures 100% absorption. And so with treating sort of leaky gut issues or inflammatory bowel conditions, we use glutamine. High dose glutamine, like 90 grams, I want to say, or milligrams, don't quote me on the exact dose. But it's really high dose that what happens, and I'm sure you've had seminars on this, like with that leaky gut, you have like a sieve-like feeling, sensation happening. That glutamine is like glue, not, and as opposed to gluten, but so that is the healthy glue that's sealing up the gut again.
That's so true. Yeah. I tell people the glutamine's the main source for the enterocytes in our gut, which are the gut cells, and a lot of times those are the ones that are damaged from NSAIDs or stress or poor food, inflammation, toxins.
Right. And so by giving that, so people feel almost instant relief, I would say. And I've had a couple people, and she's written a testimonial, I think it's on our website, but she's been to multiple physicians, GIs, and multiple colonoscopies, endoscopies, and supplements, and she's like, this IV, and she's maybe had 3 in a row. But after those 3 sessions, she was like, she feels like she's cured, so to speak.
That's great.
Yeah. So that's a really great one. A blood pressure one is a similar, great benefits, great effects. Had a person who was on 2 blood pressure medications was threatened by needing to add a third, and he didn't want to do that, and so came in. So our high blood pressure bag has high dose arginine, and it's almost like 10 grams of arginine, which is a great vasodilator. It opens up all the vessels. We also have some other sort of treatments here that improve that microcirculation, and so combined with like the Beamer mat plus his IV, his blood pressure kind of normalized. It's not quick, it's not overnight, but if you get an IV weekly, maybe by this 5th or 6th time, you're going to see long lasting and continuous improvements. And then at that point, you can supplement or maintain with supplements, oral supplements.
I was going to ask that. Yeah. Well, the great thing about that too is you're kind of in a way fixing the problem instead of, 1, covering up with the medication, but 2, you're not getting the side effects of the medication because you're just replenishing nutrients, really.
Right, exactly.
Yeah?
Yes.
That's great.
And then my favorite is the, kind of neurotransmitter boost. And based on some of those genetic SNPs that like a lot of people with mental health issues would have, and based on so we are taught in biochemistry on how serotonin is produced. And really serotonin is produced with tryptophan, which is a basic amino acid, plus vitamin C, magnesium, zinc, methylfolate, methylcobalamin, and then there's certain steps, 5-HTP, blah, 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 then you get serotonin. And so by combining, that's like the really kind of fun part of nutrient therapy. I feel like a chef times too. And so you put in all these little ingredients, and then you have a bag of, a neurotransmitter boost, and you infuse that, and people's mood get better, their energy gets better, their sleep gets better, all the things that the neurotransmitters control, which is a lot.
That's great.
We'll see improvement.
Yeah, and a lot of times it comes back to, 1, they're not getting enough from their diet, 2, they're not absorbing in their gut, so again, that's great, bypassing that and allowing the body to make its own neurotransmitters.
Right.
Super cool. I love that.
Yes, we love that too.
Super cool.
And then we have also these great sort of anti-aging molecules, and one I love, and you asked me which my favorite, it's probably one of two. One is NAD, and it's a mouthful. It's like nicotinamide adenosine dinucleotide, and then
Right there.
and then glutathione, which I think a lot of people have heard of, but again, that's still sort of our two of our master antioxidants
Right.
and super nutrients, super food, so to speak, but they're very unstable orally. And there may be precursors to both that people can supplement and take. The precursor to glutathione is called N-acetylcysteine. And then there's a precursor to NAD that's kind of coming out as the fountain of youth pill, or the anti-aging pill, nicotinamide riboside, or it's a variation of niacin, B3.
Yeah.
But the addition of when someone gets an NAD bag IV, it's like life changing. It's like lights go off in their brain, in their head, in their body. NAD is a mitochondrial energy source, a currency for them. Our mitochondria, every single cell in our body has a mitochondria, and so even it's pretty fascinating when someone is getting an IV with NAD in it. You have to go really slow, otherwise people just get this surge of energy. They just want to run out the door. and like literally, and so we slow it down. It's comfortable. But the benefits are so great. And so we have a couple uses for that. So one is just like an anti-aging longevity bag. So we kind of recommend weekly infusions to kind of keep us ticking and healthy. It is also used for like a brain reset. That's a little bit more intensive, of like a 4-day infusion, but most times that can really target mood states, anxiety states, attentional states, memory deficiencies, and kind of just give a brain a reboot. And it actually is also very effective for helping with drug detoxification and withdrawal symptoms.
That's great.
Yeah, similar with like a brain reboot.
Gotcha. You guys have a ton of choices as far as, IVs, but you've also got the float, you've got the sauna, the cryo, salt room.
Yes.
All this stuff. So if you're in St. Louis, if you're in the area, anywhere close, you need to check them out, because it's, again, the one-stop shop for all these great wellness therapies. But what's the best way? People are like, I'm interested in getting an IV. What's the best way for people to get in touch and start that process?
Perfect. If they have questions on what would help them, I'd be happy to give a little consultation with them. But both our menus, our wellness menu and our therapeutic menu, are on our website, which is www.radiancestl.com. And kind of go through those, give a call, or any of our staff members can answer those, or like I said, I could personally answer kind of any medical question if there was any concerns. The procedure is usually, you call, make an appointment. Once we have so each bag probably has about 10 to 14 ingredients. And when you take them out of their vitamin C vial or the B12 vial and inject it into the saline bag, they have a shelf life of, the freshest is probably 8 hours, and then have a total shelf life of about 24 hours. So we mix them all fresh daily. So, give a call in the morning, book your time, and then we'll make it fresh that day. So some, advance notice would be helpful. But it's easy to kind of come in on a lunch break and do an hour, 30-minute bag or 40-minute bag, and be on your way with renewed energy.
That's awesome. Great. I love all the stuff that you're offering, Dr. Zinia. You're super knowledgeable. Really appreciate you taking the time. We'll have to come back and we'll have to do some more videos on all your different therapies, because they're all amazing in their own right. So I look forward to that.
Yes, me too. Thanks so much, Seth, for having me on.
Yeah. And we'll post the website below in the comments, so it's easy just to click. You can go check it out. Their website's super clean. It's really, really nice. It's awesome. The people there are amazing. You got to check them out. Great. Dr. Zinia, thank you so much again. I really appreciate it. And I hope everyone has a great day.
Take care.